Welcome to Nephrology Today, the podcast that brings you the latest insights and discussions in the world of kidney care. I'm Michelle, and today we're thrilled to welcome Omaima Degani, a nephrologist with NANI, here with us today. Dr. Degani, thank you so much for joining us. We're thrilled to have you.
Thank you so much. I'm really looking forward to speaking with you.
Today we're going to discuss leadership. And as a physician, and specifically a woman nephrologist, you became the leader of a healthcare team. What leadership roles have you pursued, and what inspired you to do so?
So when I first started to practice, which was now 18 years ago, I became a medical director. And, previous to that, I really had no leadership roles. When you're in training, you're sort of a follower, certainly not a leader. But when I became medical director, that was my first leadership role. And at that point, I began to learn how to be part of a team just to start off with. Who are the members of the team? What are the important parts of the team? What are the strengths and weaknesses in the team? You're leading the nurses, the technicians, and the patients. And certainly, that was my first learning experience as to what a leader means, what other people look for in a leader. At that point, I myself was not sure, what a leader was and what the important role was. Certainly, over time, being in that role has then led me to other roles. And more recently, I've joined several committees, both in NANI and at the hospital. In the hospital, I'm part of a physician-nurse council, which is just a group of physicians and nurses who are just working together to collaborate and try to help our relationship between providers and nurses just be as effective as possible. And that's certainly been very interesting. I'm also in a quality review committee, which reviews other physicians and making sure that they're meeting quality requirements, that they're practicing standard of care, and if there are any negative patient outcomes, we investigate those cases. Most recently, I've joined the medical executive committee of Condell as well, which has certainly really been very, very interesting and showed me different aspects of just how a hospital runs and all the intricacies that occur between the medical staff and the administration. In terms of NANI, I have been part of the value-based care committee, which has been going on for several years, and just how we're changing our practice and what aspects of that we didn't think about before, which is how do we offer excellent patient care at the same time worry about cost. As providers, we've never really had to think about cost before. But unfortunately, medicine is such a field where cost cutting and trying to take care of patients both effectively from a care standpoint, but also cost-wise. So that's been really very interesting for me. I'm also part of the compliance committee, which is a whole nother ballgame, where we're worried about, physician compliance and compliance to billing and things like that. And certainly that has been very, very interesting. And lastly, I just joined the NANI board. So I've taken on quite a few new sort of leadership roles just over the past couple of years. And certainly being part of a board, just you see a whole different aspect, how the corporation works, how we deal with the government, how we deal with other physicians. And, amongst all that is obviously patient care first and foremost. So I think that I've just been inspired to take on these roles, just one for my own learning, because I feel like, being a lifelong learner is certainly very, very important. And the more things I can experience, ultimately it comes down to sort of for me for patient care and how can I take these things back to my own practice and to my own partners and try to effectively take care of my patients. The idea is to sort of improve my practice and even through my own experiences help others to improve their practice. And ultimately, whether it's a hospital, whether it's NANI, it's how can we do better ultimately by our patients, but still work within the framework we have to work in, which is obviously cost cutting, dealing with outside companies, dealing with payers, and things like that. So it has been very, very interesting as I take on these new roles, just to expand my own knowledge base and bring some of my own experiences to these different committees.
Well, it's a very impressive slate of leadership roles that you hold. What challenges are unique to being a woman in leadership, and how do you navigate them?
So certainly, I think that being a woman is certainly definitely challenging. In a lot of spaces, I may be the only female. And certainly, being in that situation sort of puts me in a unique place. I do feel that the female perspective is important. I do think that we see things in a different way. I think often we are willing to sort of challenge the norm, which I sometimes feel some of my male colleagues are not. And I tend to think that we see the whole picture. And I really do think that our perspective is very important. A lot of these things, I hate to say it, unfortunately, are sometimes can be just a boys' club where they're kind of, friends of each other and they know each other and they all kind of say, oh, yes, if you say it, it must be right. And I certainly do feel that, our perspective as females is different. And I think it's worth being part of the conversation. And I think in many, many spaces up until now, it's not been, which is unfortunate because I do think that there are more and more female physicians and what we have to say, in our opinion, is relevant and important and should be part of the conversation. And I don't know that it's always been part of that conversation up until now.
I love it that you're being a trailblazer for women in nephrology, specifically in a leadership role, because, women do offer a unique perspective. What advice would you provide to these women aspiring for leadership roles in medicine?
So I think the key is to be engaged. I think that it's very easy for all of us to say, we're very busy with our lives. And, and there is a lot of responsibilities that we have. I think most of us, who have families, especially in medicine, do have a lot of guilt, about not being able to be there for our children, when we can be, or for our spouses or for our family. So we do a lot of multitasking. And I think that, and there is a lot of guilt when you miss things that you feel that you should be a part of as a traditional role. And certainly as a female physician, we definitely do not have a traditional role. Balancing our work and our family lives is very, very challenging. So I think that somehow we have to sort of get beyond that. We sort of need to take care of ourselves, and at the same time also understand that there is a role for female physicians in leadership and be willing to just be part of the conversation. I don't know that you necessarily have to be, trailblazer, I don't know is what you have to be, but I think you have to be engaged. I think you have to, respond to emails, respond to things, and just have an idea of what's going on. I think it's very easy to keep your head down and just get your work done and go to work, go home, come back and forth. But I do think there is something to say about being engaged, being aware of what issues are going on around you, whether it's in your practice, whether it's in the hospital, whether it's globally, politically, and having an opinion about that and not being afraid to voice your opinion. I think there is a lot of, I don't know if fear is the right word to use, but, women feeling that, my opinion is not important, my opinion is not adding anything to the conversation. And I think that's unfortunate because I do feel that our opinions really are important and need to be heard.
Yeah, that's a good point. Women should speak up because again, they have a point of view on all of these and their opinion matters and they should feel that way too. As we think about your interactions with other leaders, what qualities have you witnessed that leaders should maybe avoid, or what qualities would you say you aspire to?
Certainly, so it's actually, it's really been a learning curve for me. It's a really good question because, as, obviously, as I said, when I first started, I had never been a leader before. And certainly over these past few years, I've taken on more roles. But it's been very interesting for me to see, who really has the qualities that you want to try to sort of obtain yourself or become like that person. And also what qualities you realize that, some leaders just are effective. And so I think that that's an important thing to do. And I really do feel that the part of the reason to join some of these things is to learn those skills, whether you use them in your leadership roles or even in your outside life. So I think that's really been a great thing for me to see what others have done. Certainly, what I have noticed is those who are really, really good leaders really are very good listeners. They often listen much more than they speak. And they really thoughtfully answer when they're given a problem. And they really try to, work with others and really try to bridge gaps between people. As opposed to trying to divide, they really try to find things in common so that they're bridging gaps between people as opposed to trying to widen gaps. And always, sort of appreciating other people's input and understanding other people's input. I think that's a really, really good habit. Just being able to acknowledge what other people are adding to the conversation. Being able to see somebody else's viewpoint, I think, is very key to being a leader. And sort of not having preset ideas when you come to a problem. And really working collaboratively to find solutions. So I think that, that bridging the gap between people is what makes an effective leader.
Yeah, I
In terms of some of the, yeah, and some of the, I guess the things that I've noticed that I feel like some leaders, they bring their egos to the meetings, and really, I mean, that doesn't help anybody. I feel like you've got to leave your ego at the door and realize that you're working collaboratively with others, and that sometimes what you think is important may not be important, and that you have to be able to understand that and be able to shift your way of thinking, and that's sometimes very hard to do. When you're kind of set in your ways and kind of believe that my way is the right way to go, sometimes being able to change that is challenging. And I certainly feel that effective leaders can change that. And those who are less effective certainly kind of stick to their guns and say, this is what I think is the case, and really it's kind of my way or the highway. And that certainly does not work in a leadership role. I think you have to understand that, you may have your priorities, but they're not necessarily everyone's priorities. So I think that's really a key skill to learn, is listening to others and understanding other people's perspectives. Those are the two key skills, I think, in an effective leader.
Yeah, really great advice. Love your perspective on that. Something that comes up a lot when talking about women taking on a leadership position role is work-life balance. How do you balance the demands of leadership with clinical responsibilities and personal life?
It's very hard. There's so many demands in our time. Family and practice, and these other roles. I can tell you, in my case, I was not able to do it until my children grew up. That is the reality, is that when my children were younger, I didn't do anything because my priority was to spend whatever time I wasn't working with them. Now my children are older, and so as a result, I can spend time, because I have more free time, to do these things. And so I think that's unfortunately, the way it is for a lot of us, is that when our children are young, as women, it's just hard. And I myself would not have really been interested in leadership at that time. So I think for my younger colleagues, I would say that there will come a time when you can be a leader, and that certainly it is hard to do it when you have a lot of home responsibilities. And I think that that's an important priority, to be there for your family when your children are young. And so maybe that's not the right time to think about doing leadership things. And I admire those with young children who are able to. I know in my case, I had to wait till my children were older. And now that they are older and they don't need me as much, I am able to then join these leadership roles and also bring, what I am as a mother and a wife to some of these leadership roles, which I think also is another different perspective that a lot of my male colleagues don't have.
Have you encountered gender biases in leadership, and how have you addressed them?
Yeah, so I wouldn't specifically say there's a gender bias. As I said, in a lot of these leadership roles, I'm the only woman. And so I think that there, as I said before, that there is sort of a boys' club where they, talk amongst themselves and, kind of make decisions amongst themselves, and don't necessarily look to other people for opinions. I do feel that as I have, joined these leadership roles and proved my ability and shown my colleagues that my, what I add to the conversation is important, I think that's how I have sort of had them sort of open up the room for me. I guess that's the best thing to say, is that often you'll walk into a room and it may be more closed off because they're used to kind of just being a group of men together. And by voicing my opinion, by having an opinion and listening, I think that I've garnered some respect with my colleagues, and as a result, they may listen to my opinion more and sometimes look for my opinion. And so I do appreciate that. And I do feel, though, however, that as a woman, we have to work harder to get that. That's not inherent. I think if a man starts to speak, kind of everyone listens and everyone pays attention. I do feel like sometimes when we speak as females, it's not necessarily taken as seriously. So maybe that's the bias, is that there is sort of a underlying sentiment about females in leadership and whether we can make the cut or not. I think once you do make the cut, then the doors open up. But we do have to go an extra step, I think, to prove ourselves to be worthy of the roles that we're given.
Let's switch gears for a minute and talk about future leaders in healthcare. What's been the best career advice you've ever received?
So for me, I can tell you is, just to do what you think is right. I mean, I think it's that simple. Whether it's patient care, whether it's leaders, whether it's, in my leadership roles, in my patient care, and in my family life, you've kind of got to go with your gut. And I think that if you go with your gut and you do what's right, whether it's for your patients, whether it's for the issue that you're dealing with, you can never go wrong. If you are true to yourself and true to your beliefs, and I think that everyone has their core values. And I think it's very, very important to stick to your core values no matter what. People may not agree with your core values, they may not understand your core values, but it's very important to be true to yourself. And don't be someone you're not. Don't talk about things that you don't know about because you seem phony. And so I feel like if you're going to speak about something, make sure you know what you're talking about, do your research, and be genuine and have integrity. I guess maybe that's the word that is the most important thing, is you have to have integrity. If you don't have integrity, I don't think you have anything to stand on. And I really do feel that having that characteristic, I guess is the word to use, so people can rely on you and that what you say has meaning, that's really, really important. And I think that would probably be my best advice is whatever you say, make sure that it has meaning, and at the same time be a good listener. So I think it's certainly a balance.
Yeah, that's great advice. How should women physicians advocate for themselves?
So I think, as we've talked about before, I think it's important to sort of be engaged and be involved. I think, as we said before, it's very easy to get sort of stuck in your day-to-day, whether it's your family responsibilities and your clinical responsibilities. But I think that we need to be able to go above and beyond that. So if there is an issue and you get an email or you get a call about something, that you should try to state an opinion. Don't just read the email and delete it. If there's something that you want to say, don't be afraid to say it. And don't be afraid to maybe ruffle feathers if you feel like it's necessary, and to put what you feel across. I think complacency, unfortunately, is a big factor, that, everything's going this way and things are going okay, and so we should continue that. But there is something to say about voicing your opinion if you feel it's worthy of giving your opinion. And I think a lot of times it is, and maybe we do underestimate the value of our opinion. And I think a lot of women do underestimate what they see as something. And sometimes, a male sort of person may say, one of your colleagues may say something, and you say, yes, okay, fine. You don't really agree, but somehow there's a, I don't know if it's a fear is the right word, but just a desire not to create conflict, and just to say, okay, whatever you say is fine, when really it's not fine. And so I think that not being afraid to state your opinion and to deal with the consequences of that is something we have to learn to do. And I think a lot of women don't want to do that. One, it requires more time, it requires more energy, and certainly none of us have extra time or extra energy. But it is worthwhile to do it if you feel that the topic or the idea is worth not necessarily fighting for, but worth expressing your opinion about. Things don't have to be confrontational, but I think that it's important to state your opinion and to feel that what you're saying has meaning.
Yeah, absolutely. And I think advocating for yourself in most situations will serve you well in the long run.
Absolutely.
How can physician leaders foster a more inclusive healthcare environment?
So I think that that's, really, really challenging, because I think that we, as a society, do have a lot of biases that, may not come out, but they are there. We have societal norms where, what the male says is typically more, just has more clout. Often I'll walk into a patient room and they'll say, oh, the nurse is here. Well, I'm in a lab coat. I have Dr. Degani on my lab coat, but still, that's what happens. I don't think that happens to male physicians. I don't think any male physician walks into a room and patient says a nurse is there. And not that, obviously being a nurse is a bad thing, but obviously when you're a physician, you want to be acknowledged as a physician. So I think that there are sort of inherited biases that we all bring to the table. And so I think as I said before, the key is just to, I think, be engaged and state your opinion. And I think when you state your opinion and you have your voice, that would, I think, help eliminate biases. And again, not be afraid to say things. And if someone does say something that is offensive, you should point it out. I think a lot of us are afraid to state things like that. If someone says something that is, maybe, not necessarily racially motivated, but sort of more chauvinistic, I think a lot of us just, we will just say, oh, that's okay. He said that, and that's okay. But really, it's not. And I think that we should not be afraid to call out things that we don't think are appropriate. So I think that's a huge thing that we as females have to overcome and be willing to make our voices heard.
I've loved our conversation here today. What advice would you have for young women who want to be leaders in the medical field, in nephrology? Like, what advice would you have to them? Should they find a mentor? How do they go about really stepping into their own and becoming a leader in healthcare?
Yeah, so that's a challenging question. I think that having a mentor is really very nice to do. I just don't know that we have a lot of mentors out there, in terms of just, finding another physician in a leadership role to actually meet with. I know that, for example, we have women in nephrology, which I just found out about myself a couple of years ago. So I would really encourage other female nephrologists to join WIN and to be part of it and to, just, go to their conference even if possible, just because I think that's a good stepping stone where you see other women in leadership roles. I think it is a little different in the community setting than the academic setting, because you do see a lot of women in academics in leadership roles, but certainly in a community-based practice, it's a little different. We're not worried about publishing, we're not worried about grant money and things like that. So I think the key is just to join things. If there's a committee and you have time, join a committee. It's a once a month commitment. And I think that once you start joining one committee, you may end up joining other committees and just seeing how those work in the background. It's very different from our day-to-day practice, from our day-to-day patient care. And certainly I just think that the best way to do it is just to join something. And, start small, start with one, and then if you find that you are given other opportunities and it's something that you enjoy, then join other ones. And that's how it worked with me. I joined one committee and then I was given opportunities to join other committees. And so I think that it's just a gradual keeping yourself open, keeping yourself available, and showing that you can contribute, which I'm sure most of female nephrologists would do. And also getting enjoyment out of it. I really do enjoy being part of these committees and giving my opinion. So I think also your own desire to do it is an important part of it.
Yeah, that's really great advice for our younger future leaders. Thank you so much, Dr. Degani, for joining us today and sharing this insightful information. I hope you'll come back soon and join in other discussions with us.
No, thank you. It's been a great pleasure, and I certainly hope that more females in my footsteps as well.
Well, you're a great role model. So you could listen to this podcast on Spotify or wherever you get your podcasts. And if you'd like to learn more about NANI or get in touch with them, please visit nephdocs.com. Thank you so much.
Thank you.